This webinar is part of the California Institute for Behavioral Health Solutions Continuum of Care Reform Technical Assistance. The project is funded through a contract with the Department of Healthcare Services. Additional technical assistance and support was provided by consultant Richard Connect. My name is Kimberly Mayer, Associate Director for CIBHS, and I will be moderating portions of this webinar. Today's webinar is Understanding California's Child Welfare System, an overview for the behavioral health system. We developed this webinar to serve as a reference for the behavioral health system and to give some historical overview to California's child welfare system. We recognize that there are sometimes differences from county to county in terms of structure and how each county child welfare system operates. It's my pleasure to introduce the presenter for today's webinar, Richard Connect. Richard Connect is a consultant and advisor to the Children's Health and Human Services community. He is a former Chief Operating Officer and Senior Executive in both private and publicly based mental health and social service systems. He recently served as the Transformation Manager to the state of California, providing guidance and system-wide technical assistance to the state's implementation of its youth and family shared management structure and associated reforms. He has published research on family-centered residential services and is a fellow of the Sierra Health Foundation's USC Marshall School of Health Leadership Program. He is a retired director of Placer County's highly regarded children's system of care.
Thank you, Kim. It's nice to be with you today. We hope that this work will be useful to you as you work with CPS and child welfare partners in your community. As we go through our material, we hope at least 4 outcomes are possible for you today. 1, that you'll have an understanding of the historical elements of child protective, foster care, and related welfare efforts. That you'll have an increased understanding for the purpose and role of welfare efforts in your community and the structures which support them. That you'll have an understanding of the relationship between federal, state, and county welfare efforts. And that you'll have a recognition about some of the unique issues associated with providing collaborative services to youth and families. We're indebted to 2 sources of information for our webinar content today. Much of the information is from the Child Welfare Information Gateway and its parent funder, the U.S. Department of Health and Human Services Children's Bureau, and secondarily from the California Center for Research on Women and Families. The effort known as the Continuum of Care Reform draws together a series of existing and new reforms to the state's Child Welfare Services Program, designed out of an understanding that children who must live apart from their biological parents do best when they are cared for in committed, nurturing family homes. Assembly Bill 403 provides the statutory and policy framework to ensure services and supports provided to the child or youth and his or her family are tailored toward the ultimate goal of maintaining a stable, permanent family and reducing trauma on all involved. Reliance on congregate care should be limited to short-term therapeutic interventions that are just one part of a continuum of care available for children, youth, and young adults. While Assembly Bill 403 is a wonderfully designed piece of legislation, it does create challenges for state and county implementation efforts. As part of CIBHS's efforts to work with DHCS around CCR, CIBHS has developed this webinar for behavioral health care systems. The webinar is focused on providing an overview and purpose of California's child welfare system. We recognize that many county child welfare and behavioral health systems are already collaborating and working together. Let's begin with a short look at the history of child protection and intervention. Before the 19th century, there was no public authority or involvement in protecting or ameliorating neglect and abuse. Some of the more zealous groups removed children from their homes with little regard for parental rights, and there was no court oversight. By mid-century, awareness had grown about what constituted child neglect, and faith-based systems often mobilized without government involvement to protect children. Some of these agencies practicing early still are available on the East Coast and function as children's aid societies. Like all providers, they've evolved and adapted their care models and today are active and involved partners in foster care services delivery. By the late 20th century, federal and state laws existed and were sometimes implemented inconsistently. Perhaps the most egregious example is the relocation of large numbers of Native families. Perhaps, they were relocated for reasons not for abuse or neglect, but out of belief that children would be better served in non-Native homes. This is known, of course, as the Trail of Tears. The first real funding of child welfare efforts began around 1935 and links the state's involvement to court systems for independent oversight. It wasn't until 1974 that the first mandatory abuse reporting laws began in this country. There are 3 levels of government support and oversight to the delivery of child protection and foster care services. Federal and state laws establish the legal, regulatory, and fiscal frameworks that govern the roles and responsibilities of agencies and organizations for children and families that enter and leave the child welfare system. There are now nationally recognized goals for all child welfare systems focused on safety, permanence, and well-being. The federal government itself is a complex organization and uses various vehicles to fund child welfare. Each of the 4 programs listed here is intended to assist state, county, city, and tribal governments and public and private local agencies to provide services through funding allocations, policy direction, and informational services. Known also as the Children's Bureau, the federal authority funds a number of programs that focus on preventing abuse and finding permanent placements for children who cannot safely return to their homes, and supporting independent living program services for youth who will or have left the foster care system. The Children's Bureau also supports system improvements through a series of national resource centers, regional implementation centers, and discretionary demonstration grants to states, counties, and community-based organizations. The federal administration offices have a significant role in building accountability in child welfare. Prior to 1997, there was little data-based or outcome monitoring. Today, there are 7 large outcome areas, and each of those has a number of sub-elements. A couple of examples might include monitoring the reduction of recurrence of child abuse or neglect, seeking a reduction in the time in foster care to reunification without increasing reentry, and of course monitoring placement stability. In California, counties can access a statewide clearinghouse known as Safe Measures to get monthly performance matrices. Each part of this plan is what's driven a 40% reduction in the number of foster youth and out-of-state placements since 2000. There are 4 processes that federal authorities use requiring states to implement this oversight effort. Each county or jurisdiction must conduct quarterly data reports. Each county must conduct a self-assessment process along with its probation partners. Each jurisdiction is also responsible now for conducting case reviews that involve a structured analysis of the documentation of care provided within a child welfare services care episode. These 3 elements roll up into a 5-year planning, which is commonly referred to as a system improvement plan. These plans are monitored by the county, of course, first, and then by the state, and ultimately make their way into a federal report.
So Richard, do counties report this data directly to the federal government for these types of outcomes?
Well, typically the state would aggregate all the county information and then would make a statewide report to the federal authorities. Only in the cases of specific grants awarded to a county would there be an independent reporting from the county directly to the feds. So let's take a look at the state level services. California is one of about a dozen states that uses a state-administered, county-implemented model. Other states have a state-administered and state office-delivered system with no county-specific jurisdictions. Each of California's 58 counties conducts its own child welfare services, while CDSS, the state agency, serving as a large administrative services organization, monitors and supports counties through regulatory oversight, administration, and the development of program policies and regulations. Within that large state department, 2 divisions are most critical to youth and families, those being the Child and Family Services Division and Community Care Licensing. Among many duties, CDSS oversees most aspects of the county-delivered service model. Those administrative and regulatory processes include training, best practice implementation, quality assurance, and the statewide data system known as CWS CMS. The Department of Social Services also has an independent office of Ombudsperson, which investigates and attempts to resolve complaints made by or on behalf of children placed in foster care, and compiles all complaints received in an annual report to the legislature. All county child welfare workers are required to provide foster children with information about the Ombudsman's office. Counties also have a local ombudsperson. The state has recently championed innovative youth representation by employing a senior manager ombudsperson who has lived experience in the foster care system. This may be a first-in-the-nation effort on California's part. One of the department's major objectives is to assure that all of the various community-based agencies that serve foster youth are safe and offer a high quality of service. This licensing process oversees a host of different types of service, out-of-home services, including foster family homes, small family homes, foster family agencies, group homes, community treatment facilities, and transitional housing placement facilities. They each have their own set of licensing expectations. CCL will also oversee licensing of the new short-term residential treatment programs. Separate but related to the State Department is the Child Welfare Council. A number of years ago, California identified a desire to bring together diverse leaders to provide independent advice to CDSS and its partners. The Child Welfare Council was born and today meets quarterly in a vibrant, day-long conversation in pursuit of enhancements to the welfare and related systems. Now let's take a look at the county-level agencies. Under guidance and oversight from CDSS, each county delivers its own CPS and welfare-related services. These can generally be broken into four kind of functional areas, including child protection or the prevention of abuse and neglect, foster care, guardianship, adoptions, and permanent planning, a county ombudsman's function, which we've just talked about, and compliance, outcomes, and accountability.
So, Richard, can you tell us a little bit more about the relationship between the county ombudsman and the local child welfare authority?
Sure, it's an interesting relationship. While the Ombudsman's office and function is hired by or provided by the local Child Welfare Services Authority, its role and intent is to provide an impartial and objective ear for consumers who have concerns about the agency's work. It reports to the county, but liaisons to the state Ombudsman's office as independently as possible. Now that you understand the structures of the federal, state, and county authorities involved, let's take a look at what the actual services look like. Each county has a 24-hour telephonic triage service. This busy schematic outlines the major services and steps along the journey of a family in the child welfare system. The Child Welfare Services Authority's actions are typically represented here in the tan or taupe color. The court's role is captured in the blue hued circles along the top. There may be, of course, local rules or agreements that adjust in minor ways in this general process. The slides that follow, of course, will explain much of this process in greater detail. Each county has its own telephone number for reporting suspected abuse. This part of the CWS response is known most often as Emergency Response or ER services. The Standard Safety Assessment System evaluates the safety, risk, and needs of children and families who are referred to the Child Welfare Authority. Most counties have senior or supervisory staff that review all decisions. Unlike decades ago, tools are in use today which most often inform the investigation and conduct of the investigation on behalf of children and families in order to protect parental rights and assure due process. Differential response was pioneered in the 1990s in Minnesota and has been in use in California for about 15 years. Depending on circumstances, a traditional investigation by a child welfare agency is not needed in every case or every referral. While maintaining a fundamental commitment to child safety, differential response is a strategic three-path approach that's in use in about 40 California counties. Path 1 represents those cases which have minimal risk, usually resulting only in a referral for supports or services. Path 2 focuses on voluntary involvement in services. However, in the interest of protecting the child, the authority of the court may be utilized. Path 3 is most similar to the child welfare system's traditional response, in which case efforts are made to engage the family, especially non-offending parents or other protective adults, to preserve the connections between the child and other family members. Ideally, bio-caregivers are willing to engage in assuring their children are safe and well. Family maintenance cases typically allow families to be together without detainment. The family maintenance funds that counties receive from the state are typically available for up to 12 months of service. Court-ordered family maintenance services may be extended by 6-month intervals and continued indefinitely if it can be shown to the court that the objectives of the service plan can be achieved within the extended time periods, and if the services can be provided within the county's child welfare services allocation. Family maintenance services are provided based on a case plan developed by a child welfare worker and the family. And they include, but are not limited to, counseling, emergency foster care, respite care, emergency and home caretakers, substance abuse treatment, domestic violence intervention and services, parenting education, and others. Family maintenance ensures that counties have ability to protect the minor while working with families to minimize disruption and trauma. In cases where a minor has been removed, counties seek diligently to reunify the family as quickly as possible. Family reunification services may be extended beyond 6 months for a child under the age of 3 or beyond 12 months for a child over the age of 3, as long as the court finds that there is substantial probability that the child will be returned to the physical custody of his or her parent or guardian within the extended time period, or that reasonable services have not been provided to the parent or guardian. Child welfare agencies are required to file a petition to terminate parental rights when a child has been in foster care for 15 of the past 22 months. The service plan must be satisfactorily fulfilled for the child to be returned home. In cases where longer-term out-of-home care is necessary, permanent placement services apply. There are many forms of permanency. Permanent planning services begin concurrently to other services and are intended to assure safe and stable care for minors placed away from their primary caregivers. Adoption is the preferred long-term placement option, of course. We'll talk more about adoption shortly. When intact families cannot be successfully served, adoption is often preferred as the second plan. To prevent completely severing a child's existing family connections, California adoption law now allows parents or relatives to enter into a post-adoption contact agreement with the adoptive parent, subject of course to court approval, where parents or relatives continue receiving information about and or maintaining contact with the child. Examples of exemptions include a child whose parents have maintained regular contact where the child might benefit from continuing the relationship, a child who is 12 years of age or older and objects to being adopted, and if the adoption will interfere with the connection of a Native American child to his or her tribal community, or the child's tribal membership rights. In some Native American tribes, adoption with termination of parental rights can mean the child loses citizenship in the tribe along with the benefits received from tribal membership, so these can be sensitive issues. Timeliness to adoption is a major statewide improvement in the last decade and contributes to stability and well-being more often than not. Aid to adoptive parents funding supports youth in and after adoptions. Historically, these would include counseling, case management, or community supports. California partners are excited and of particular interest to mental health partners and providers in that the state has been identified as one of 8 national piloting sites for the development of adoption-competent clinicians, recognizing the need for specialty mental health intervention throughout and following the adoption process. Nearly 2,500 California practitioners have been signed up and will be trained by the end of 2018. Being in foster care can be very stigmatizing. One way this can be greatly mitigated is by having caring extended family members provide care and supervision to the victim. California youth in dependency are placed into kinship settings in approximately 45% of all out-of-home cases. This is a significant improvement since 1998, due largely to timely location and connection making with extended family members. We call this family finding. Similar to adoption, although guardianship does not provide the same level of permanency that is afforded through adoption, guardianship can facilitate continuity of formal and legal ties to the child's biological family, which may be in the child's best interest. Legal guardians have authority to make decisions on behalf of the child that a biological parent would make, but have no legal obligation to support the child financially. The biological parents continue to be legally required to provide financial support for the minor. If a relative becomes a guardian, the child welfare and dependency court cases may be closed. Through the Kinship Guardian Assistance Program, known as KinGAP, the relative may receive ongoing financial assistance for the child in the same amount that the child would have received if he or she had been in a foster home. Most non-related legal guardians receive similar financial assistance under the state AFDC foster care program and remain under the supervision of the court. Joining many other states, based on widely celebrated national research from the University of Chicago, California now makes foster care status and its supports available to youth aged 21 and older, and with some supports continuing beyond that. This is now used by about 7,500 youth statewide and may be one of the factors in California's declining arrest rate in the last 7 years. Let's spend a minute talking about the Indian Child Welfare Act. Tribal partners are critical to successful foster care for youth with Native identity. ICWA, the Indian Child Welfare Act, provides unique supports and is intended to assure Native youth are served in a fully culturally proficient manner. Child Welfare Services county partners and tribes work together to assure cultural and ethnic supports are accessible and available to the youth and family. While California has many tribes, there are very few tribal courts. Let's talk now about some of the child welfare's outstanding partners in dependency. Formerly known as the Administrative Office of the Courts, the State Judicial Council is the statewide administrator of county court services. Under the leadership of the Chief Justice and in accordance with the California Constitution, the courts deliver guidelines to themselves and to make recommendations annually to the governor and legislature. And they also adopt and revise California's rules of court in the areas of court administration, practice, and procedure. The Welfare and Institutions Code, Section 300, provides the legal basis for juvenile court jurisdiction and authorizes the court to remove children from the care and custody of their parents if such action is necessary to keep the child safe. Large counties may have 2 or 3 juvenile officers, while medium and small counties may have a single judge or commissioner who may have other duties. There are other legal advocates that partner with courts and child welfare authorities. The state constitution provides that all parties to a CWS proceeding have legal advice. County departments have an attorney assigned. The court assigns a lawyer for the youth and family members who may also bring their own counsel or have one appointed at taxpayer cost. In most counties, these advocates work collaboratively to help the youth and family navigate the system and quickly reunify without additional trauma. Occasionally, dependency cases can become adversarial. One key partner working with child welfare is the Juvenile Probation Department. In addition to local law enforcement, county probation departments and juvenile courts work with local school districts and child welfare and behavioral health departments. County probation departments are also responsible for operating juvenile halls, camps, and ranches. At the state level, the Division of Juvenile Justice maintains 3 secure facilities and a conservation camp for lower-risk offenders. For example, a 15-year-old arrested for the first time for skipping school might be counseled and released. At the other extreme, the most serious cases may be directly filed on or remanded to the adult criminal system. Most of the time, however, law enforcement refers the arrestee to a county juvenile probation department. About half the time, the probation department either closes the case or prescribes informal probation or a diversion program, which might include education, community service, or restorative justice types of services. More serious cases warrant a juvenile court hearing, but judges have a range of options short of committing youth to a county facility. Of the approximately 150,000 juvenile arrests made in 2011, for instance, only 11% resulted in confinement, and fewer than 1% resulted in commitment to a Department of Juvenile Justice facility. A 2007 reform permitted counties to commit only the most serious offenders to state facilities. Between 2007 and 2013, the year-end number of juvenile offenders in the Department of Juvenile Justice institutions and camps fell from just over 2,100 to under 700. The share of youth in these DJJ facilities for homicide increased from 5 to 12.4%, and for assault from 32.2% to nearly 40%. A subsequent reform gave counties responsibility for all offenders released from DJJ, resulting in a drop in state parole numbers from 2,462 to 0 between 2007 and 2013. One contributing factor is that between 2007 and 2012, the juvenile arrest rate fell by 42% to its lowest level in decades. This trend mirrored a general decline in felony arrest rates for young adults across the state. Here's a quick look at some big picture probation demographics. There are 27 juvenile detention facilities and about 55 camps run by county agencies. Of the nearly 40,000 youth with open cases in the probation system, about 80% are 602 misdemeanor offenses that receive services that typically involve community supervision. Rates of foster care and group home care for a youth involved in the delinquency system have declined by more than 50%, which reflects outstanding work on the part of the county probation departments around the state. Welfare agencies have other critical allies helping in their work. A growing body of research has shown that family and youth both do better when someone with lived experience can walk with them through the system, helping to navigate and support them. These bullets show some of the roles played by youth and parent partners. These partnerships are either purchased by the agency via a contract or in some cases may be employed directly by the county department. Increasingly, there is awareness that foster youth most often need intervention or support from the mental health community to effectively cope with their trauma. All foster youth are automatically eligible for Medi-Cal, and under recent KDA settlement agreements and the Continuum of Care reform, all youth are screened for mental health needs, and many are assessed and found to meet medical necessity criteria to receive mental health or behavioral health care. Since 2014, county mental health plans have been invited to coordinate with regional or local managed care companies who were awarded contracts to deliver care to less acute beneficiaries. Counties and managed care organizations have agreements in place which are intended to assure timely assessment and referral and care coordination for all Medi-Cal eligible youth, including foster youth. Substance abuse services are historically not well funded at the federal or state level, especially for youth. There are limited funds available, and most counties have some SUD services available, usually accessible through the mental health plan.
So Richard, is Medi-Cal eligibility the same for former foster youth as those currently in the system?
The eligibility criteria are the same, Kim. While there are special services available for former foster youth through the legislation commonly known as AB 12 or non-minor dependent services, the eligibility criteria themselves are the same. Other partners include those listed here. Each of these entities provides a mandated and often valuable adjunctive role to the protection and safekeeping of a minor. The scope and reach of these services will vary by county, but often mental health clinicians working with Child Protective Service involved youth will want to be aware of the partnerships and resources available in the parallel health and social service systems represented in this slide. Let's talk for a minute about the last 15 years of improvements that have been implemented and are resulting in many enhancements for youth and families in the child welfare system. We'll take a look at just a few today. Since 1997, counties and state agencies have developed and implemented many evidence-informed or evidence-based improvements. Safety organized practice, wraparound, child and family teaming, and others all share a major objective of assuring authentic engagement with biological family members and service planning that seeks to connect the youth and family to their natural supports where they can be most effectively served and where stigma is minimized. Resource family approval enhancements are intended to assure any caregiver is fully trained and supported. Soon the state will have an integrated core practice model, which will be a cross-system guide which captures how staff in all service sectors work with families in a culturally responsive, family-centered, and strength-based manner. California will be the first state in the country to have a fully system-wide core practice model. It takes an integrated and shared approach to funding child welfare services. Let's take a look at some of those processes and functions. The federal Aid to Families with Dependent Children foster care program is a part of what's known as Title IV-E funding, which pay for placement or the board and care services that foster youth need. Foster children are also categorically eligible for Medi-Cal, as we've mentioned. Children who do not meet the eligibility criteria for federal foster benefits are eligible for assistance under the state foster care program or the CalWORKS program if they are placed with a relative. The federal system, which funds foster care, is now more than 20 years old and badly in need of reforms, but consensus has proven challenging for many reasons. As we start to tie up our presentation, let's take a quick look at recent patterns of care which might be helpful. In recent years, about 400,000 actionable referrals are processed statewide, representing about 68% of all calls received. In other words, about 32% of the calls that are received are not, do not reach the threshold for any action on the part of the county. There are currently about 63,000 open dependency cases in the state, which is again a significant reduction from about 15 years ago. Non-minor dependents number around 7,500 statewide, and there are about 12,000 youth awaiting adoption. The state completes successfully about 6,100 adoptions each year. The largest county population, of course, is in Los Angeles, where they have about 40% of the state's overall child welfare population.
Thank you, Richard. As you'll see, CIBHS has developed additional resources which you are welcome to click on this website for further information. We appreciate you joining us, and the contact information is listed on the last slide here. Thank you very much.